Welcome to iAdvocate, a podcast series on the public policy process developed by the Emergency Medical Services for Children National Resource Center. In this lesson, you will hear from Dr. Dan Fagbuyi, Medical Director of Disaster Preparedness and Emergency Management at Children's National Medical Center. He will discuss his own efforts in influencing the public policy process and why others should become involved in advocacy. What kinds of advocacy have you done? So meaning at what level, on what issue, what kind of activity, by yourself or with others?
Advocacy work that I've done at least is on every level, from the individual level to the community level to state and federal level. So I do it in my daily work every day. And then I partner up with other organizations to fulfill that journey. The topic that I'm really involved in is disaster preparedness and emergency response for children in general. And an example is the American Academy of Pediatrics. I am on the Disaster Preparedness Advisory Council, and I work with the Academy along with its other subject matter experts to advocate for children in disasters. We went to Congress and I testified before Congress, the Homeland Security Committee, to discuss issues related to disaster preparedness.
Why was it important for you to advocate?
It's very important. That's what I do in my daily life. Advocacy doesn't mean you have to carry on a banner and run around, but you have to be able to have an impact on the individual level, but also on a global level. So there are many levels of advocacy. It's very important because that means there's a problem, and a problem needs to be fixed. And by you advocating, you're attempting to fix that problem.
Going back to the example you gave regarding advocating for disaster preparedness, were you successful in your efforts?
We've come a long way, put it that way. Even before I came into emergency medicine and into the disaster world, there are many of my predecessors who have been toiling and putting in the hours to make children in disasters and their preparedness efforts be well known and to be successful. So it's been a long road, but yes, we have made many strides and we still have a lot of work to do.
Very generally, in your advocacy efforts, what did you find worked and what are there things you found that didn't work when you went out with your partners to try to affect change?
So I think one word I would say is collaboration. A great example is from the congressional members. If you're going to go testify before them, you should know what their concerns are and what they stand for. What have they advocated for in the past? You want to align your concerns and goals with what their agenda is. You want to tell a story. You want to give them the facts, what they really need to know in the whole process of advocating.
You mentioned the importance of storytelling as well as facts and figures. Do you think one has a greater impact versus the other, or do you think it's important to have a little bit of both?
I think you have to have a little bit of both. It's great to tell a great story. Stories tend to resonate with people, and if it's a powerful story, they'll actually remember it even long after the discussion is over. The other piece are facts and data. For example, there are over 25% of the population account for children. And in disasters, if children aren't addressed or prepared for, that's 25% of our population. So you give them a statistic, and then I can give a story of children I saw in the emergency department, or we can give a national story that was on the news, Hurricane Katrina. We can talk about Haiti. So their examples and their statistics, bring them together, give a personal story. That's your pitch.
So why is it important for others to advocate?
As a pediatrician, we have the story, we have the credibility. We take care of them all day long. That's what we do. You have a story to tell, and now you need to tell the story. Give it a face, give it a voice, and push the information out there. All we're doing is speaking up loud for the children. That's it.
You mentioned EMSC earlier as one issue you've worked on. Why should other people care about EMSC?
EMSC actually focuses, as it says, emergency medical services for children. There's EMS, but there's EMSC, and that makes a big difference when it comes to children. They advocate for children, They develop performance measures for what the care of a child should be and the care of an injured child. They also advocate for children in disasters. They've done a lot of work in many areas and also informing policy. This is what they've been there for, and they've shown a huge difference and in change and improved care over the years through the work of EMSC. Were it not for EMSC, I probably wouldn't be pursuing some of the work that I do.
Do you think that advocacy is a natural extension of what physicians and other clinical care providers do in their daily job?
I definitely believe that advocacy is an extension of the natural work that physicians and all other providers do in their day-to-day job. Advocacy from the state level, local level, federal level, and in an individual basis are a continuum. It's how far you push it. On a day-to-day basis, we do individual advocacy for our children at school and for our patients that we see in the emergency department. When you see that there's a problem and you address it, you're an advocate. When you see that there's a problem and you push it up the chain, be it writing up a letter to a Washington Post, or even on a local level, writing to your child's principal or something to the PTA organization, those are forms of advocacy where you speak up.
You mentioned earlier some of your experience with advocacy. Where did you go to find the resources you needed to be a successful advocate?
I think most of the organizations that I had mentioned before, such as the Academy of Pediatrics, Emergency Medical Services for Children, and other entities that actually do work in the area of children, Safe Kids is another example, have specialists that actually work with them and representatives that work on certain issues that are near and dear to their heart. What you need to do as a physician is to actually align your concerns or the area of interest that you have with that group. So I went up to AAP and said, hey, who's in charge or who's running your disaster work? I got a point of contact, said what my interests are. Oh, we have an opportunity for you to weigh in on this issue as it relates to disasters. Oh, by the way, would you like to be involved in our council membership that actually does this sort of work? Oh, again, and by the way, we have a bill that's going through the Senate, and we would like to have someone testify regarding the issues that you've seen in your experience during H1N1.
Thank you for joining us for this lesson of iAdvocate. In following lessons, you will hear about the importance of advocacy from the perspective of a pre-hospital provider, an EMSC grantee, and a family representative.